Good evening, sir. Welcome to the day 2 of the conference in the temple city of Bhubaneswar. Sir, would you like to give a brief introduction about yourself and from where have you come from?
I'm from Kolkata. I'm Doctor Chandan Pathak and I'm a faculty here. So I've deliberated on my topic here, distal femoral fracture fixation in periprosthetic fracture. So it had been a nice academic atmosphere, nice interaction amongst the faculties and delegates. The main unique purpose of this conference is this happens once a year, and this is an academic podium where you get to find all related joint replacement and its complications, starting from scratch level to the revision level, and that is one platform where everybody comes to learn actually. And this is a sort of revision for the learned persons and re-revisions for the juniors, and it's a great academic platform to learn, exercise newer techniques and revise the older techniques and see other surgeons' results all over India and out of the world also, all over the world also. So it's an interaction of academics, it's interaction of difficult cases, interaction of ideas, and ultimately comes out with a newer technique, newer philosophy, newer knowledge.
Doctor, kindly share any of the new technologies which is being discussed over here.
See, nowadays in the era of communication, it's all robots. So how robotic technology is being inducted into the field of joint replacements and how it is going to do a miracle, and whether it is going to be a game changer in the joint replacement scenario. So this is just a beginning, and years after years that will be modified and advanced. So all are in the benefit of the patients and the science.
Doctor, do you think like how much the patient community is comfortable with this changing technology?
No, the patients will be benefited. Only thing is that it's a cost constraint, and with more and more number of robotic technology coming in, I think cost will come down. It's an initial cost for the hospitals to procure it, and definitely initial cost on the burden of the patient. But if you consider the longevity of that implant in the long run, possibly it is worth.
So is the longevity also decided by conventional or robotic, or it is same for both the procedure?
No, longevity, it's not only dependent by robotics. It's the proper soft tissue management. It's the alignment. All get together. It's the minimum exposure, and it's the robotic alignment that dictates the surgeon on the table that you are right or you are going wrong. So you can identify your mistake in a 90% or 95% case on the table. You can rectify, and ultimately you can get the job done approximately almost 99% perfect. So definitely it has got an importance on the longevity, possibly in the longer run. You cannot say now, but 15, 20 years down the line you can say.
And lastly, how do you like the hospitality of Bhubaneswar?
Oh, that is absolutely great. So the hospitality, the electrifying atmosphere, the sincerity of the organizers, these are outstanding, just unbelievable. So thank you, Bhubaneswar.
Thank you so much for your time. Thank you, sir.